thank you all so much for being here. I bet this is probably your first press conference in such a warm conservatory, so we're thrilled to welcome you here. I'm especially thrilled to welcome Lieutenant Governor Mandela Barnes to Stevens Point today. I'm Representative Katrina Shanklin. I represent most of Portage County in the Wisconsin State Assembly. And I also have with me Karen and Tim Hannon, who are homeowners in the Stevens Point area. So we're here today to discuss an important issue that affects everyone in Wisconsin: access to clean and safe drinking water. I'm thrilled that in his State of the State address, Governor Tony Evers announced that 2019 is the year of clean drinking water. Access to clean drinking water is a right, not a privilege. And the state needs to do everything we can to help people access clean drinking water in Wisconsin. I'm excited that Lieutenant Governor Mandela Barnes is here today to tour the water lab and to hear from people directly who are most affected by contaminated drinking water. We are here to call for action in the state legislature to help. For years, I've heard from constituents in Portage County and from homeowners across the Central Sands and all of Wisconsin who just don't have access to clean drinking water. These folks work hard, they play by the rules, yet they can't even drink the water from their taps. Instead, they buy bottled water. Here in Portage County, we found that 1 in 4 private wells are contaminated with nitrates. In the village of Nelsonville, 47% of the wells are undrinkable. This is unacceptable. The state of Wisconsin needs to provide immediate relief to these people and ensure that they have access to drinking water moving forward. That's why I've introduced bipartisan legislation to create a first-of-its-kind private well testing program, which would provide grants to local governments to help homeowners test their private wells so they can know what's in their drinking water. The bill then dramatically expands the well compensation grant program, so when homeowners find out that their water is undrinkable, they can fix it right away with help from the state. This bill is a promise to the people of Wisconsin. We recognize the spot you're in, and we want to help you fix it. I hope to see this bill receive a public hearing as soon as possible so we can move this legislation forward and provide homeowners like Karen and Tim the support that they deserve. I'm pleased that Karen and Tim Hannon are here to discuss their situation and tell more about why we need legislative action on this bill and the year of clean drinking water. So Karen is right here for us.
Okay. My husband and I live in Stevens Point. We have an old farmhouse. It's about 100 years old on about 25 acres of land. And we've pretty much spent the last 40 years remodeling the place and doing a lot of landscaping on it. And our property is kind of what we consider the dividing line between subdivisions and farmland. Back in June of 2014, I noticed that there were some changes in our drinking water. So I took a water sample into the university water lab. We had noticed that there were some rust in some of our fixtures, and there were some black spots on some of the clothing. So I was pretty convinced that a water softener would solve the problem. I was wrong. Results of the water sample came back with nitrate levels at 68.5. Water isn't safe for consumption by humans or animals above 10 parts per million. Over the past 3.5 years, we've had our water tested monthly at the water lab at UWSP. Nitrate levels have fluctuated between 35 and up to 71.5. At no time have the levels dropped low enough or below 35 where we could consider reverse osmosis as a way to correct the problem. The inability to drink our water has really impacted our lives. We purchase bottled water 2 to 3 times a week. We're very careful to use bottled water if we do any cooking of something that would actually absorb the water into our food. We've had warnings for years that babies can be affected by high nitrate levels in pregnant women. Well, now the DNR has a bulletin out that talks about some of the effects that it has on adults. It can result in head and neck cancers and gastric cancers. On one of my recent visits to the doctor, we kind of talked about what kinds of signs and symptoms we should be looking for, and he discussed what kinds of tests we might want to pursue in the future if we see some of those things happening. In the past, I had hoped that this high level of nitrates was just a fluke and it would go away. Well, it's been 4 years now, and it hasn't.
Thank you for letting us be here tonight. For the last couple of years, we've talked to a lot of different officials, city, state, well, the water department at the university about our well and what to do about it. And last summer, we had been referred to the state geohydrologist who came out to visit us to see what could be done. And he came out, he had an amazing amount of information that he had done before he got there. He had looked at the groundwater contour, the flow, well depths, and different aquifers that were out there. And so he came out and he met with us and looked at everything, looked at the site, and suggested that what we should probably do would be to move the well 100, based on the contours, move it perpendicular to that 100 feet to the north, and probably put in a well that was shallower than the one that we had. So we said, you know, that would be fine. But then we looked at it and said, you know, all of a sudden, you know, the price of wells is pretty expensive. It's not insignificant. And then we were referred to the DNR. They told us that there was Wisconsin has a well compensation grant program, but my wife and I are both retired, so you know it gets harder to do that. And under the grant program, there's 3 requirements. One is that you have to have the contamination requirements, which we have. Another one, we have to have income limits, which because we're retired, we're under that. And the third part was that you have to have livestock that consume 100 gallons of water a day. So, you know, we're retired and we just don't have any livestock like that anymore. Representative Shanklin's bill removed the requirement to have livestock in order to qualify for the grant, and also to create testing create a testing program. We spent the last year talking with a lot of friends and neighbors about the importance of having well tested regularly. I believe if there was money available for education and testing, more people would have their wells tested and be able to provide safe drinking water for their families. We're very thankful that the bill has bipartisan support, and Governor Evers and Lieutenant Governor Barnes have declared 2019 as the year of clean drinking water. We're hopeful the legislator will act right away to ensure homeowners like us can have access to clean, safe, healthy water. Thank you.
Thank you so much, Karen and Tim, and it's my honor to introduce Lieutenant Governor Mandela Barnes. Welcome to Stevens Point.
Thank you. Thank you so much, Representative Shanklin. Thank you so much, Karen and Tim, for sharing your story. It's a story that we hear all too often around the state, and it's an issue that we have to get serious about, and that's why I'm proud that Governor Evers has declared 2019 the year of clean drinking water. So again, good afternoon to everyone. I want to first start by thanking the UW-Stevens Point Chancellor Patterson and the Center for Watershed Science and Education for hosting us today. I want to thank you again, Karen and Tim. We had a chance to talk to a number of scientists about some water remediation ideas and what contamination looks like in different parts of the state. I learned a whole lot. It's a whole lot of information. Representative Shanklin is our expert in the legislature, apparently, on these issues, and I'm glad that we have her leadership to hear these issues. And I can say that she's done that since I've known her, since we were elected together in 2012. But now we have an opportunity to get very serious on this issue. Again, an unfortunate reality for too many people in the state is that their drinking water is toxic, and it's having an impact on their health and their well-being. And access to clean drinking water is a right, and we understand that. It's something that everybody in every community across the entire state of Wisconsin, across this entire country, should be able to access. And it is unacceptable that in 2019 that we're facing so many clean drinking water problems, from lead to nitrates to bacteria to toxic chemicals. Wisconsin's drinking water woes deserve serious attention and action. Inequities and accessibility of safe water in the decision-making process is especially important for environmental justice. As you see, communities of color, those living in poverty, and those in remote rural areas of the state are the most impacted by risk to drinking water. Contaminated drinking water disproportionately impacts our children's health as well. Lead in the water has significant impacts on childhood development, and excessive nitrates can lead to blue baby syndrome, as well as miscarriages, birth defects, and diabetes. Bacteria and contaminants in many wells can lead to severe gastrointestinal issues as well. Last month in the State of the State address, Governor Evers again declared 2019 to be the year of clean drinking water in Wisconsin, and now we're ready to get to work on that issue. We're going to put science back at the center of decision making to make sure that we're making the best and most informed decisions with the best information available, and that we're going to make sure that we're adopting the best practices to prevent the contamination before it even happens. That means investing in studies at the Department of Natural Resources to determine the full extent of the problem, developing concrete plans to address existing contaminants, and making sure that the public is informed and can take action when contamination is found. We're going to work with scientists, health professionals, and natural resources managers. We want to offer an evidence-based policy and a funding package as well that tackles both urban and rural drinking water problems and protect people's health. One of our first steps will be an executive order to designate a person at the Department of Health Services to take charge on addressing Wisconsin's lead crisis, to help connect the dots across agencies and make sure that we're doing all that we can do to prevent lead contamination and abate existing lead contamination. Both legislation that Rep. Shanklin is introducing and the initial steps taken by Governor Evers and myself are just the beginning of our efforts to restore science back to the Department of Natural Resources and to protect the health and safety of both our environment and of our citizens. It's time that we finally make clean drinking water a priority in Wisconsin. It's fundamental to the health of individuals across the state and to future generations as well. Thank you again, Representative Shanklin. Thank you again, Karen and Tim. Thank you all for being with us, and we are ready to take a couple questions if you all have any. Okay, all right.
Sorry.
Quiver.
So Governor Evers said that he wants to budget about $70 million to help with the clean drinking water as well. How does he plan to use that budget exactly?
Yeah, again, I talked about a lot of the remediation efforts and also a lot of the preventative measures as well to stop contamination before it even happens. There are a lot of details still to come out, but I think it is a worthy investment. If you look at health savings across the board, you look at other issues that we won't have to deal with because people have access to clean and safe drinking water. It is a wise investment. I don't think there are too many people that will see a problem with us making sure that we're prioritizing health and safety. Everybody drinks water every day, or you should. If you don't, you should. 8 glasses. But we want to make sure those 8 glasses are free of contaminants.
I know one of the problems with tackling this issue before was you don't want to vilify farmers. Because a lot of the times that's part of the problem is it's farming practices. How are you going to tackle this issue by not doing that and still helping people?
Yeah, it's about working together. Because people in rural communities are impacted as well. Farmers are impacted as well. So we want to make sure that everybody is at the table when we're coming up with the best solutions. We have to figure out what makes the most sense. We have to keep up our agriculture industry in the state. We are fully understanding of that. But the way that happens, it has to happen more equitably. We have to make sure that everybody, that again, we're not compromising anyone's health and safety. This is about all parts of the state of Wisconsin working together.
One model that works for that is producer-led watershed grants in the state under DATCAP. They bring farmers, the producers, to the table to plan out strategies and best practices when it comes to agriculture. So we have 2 producer-led watershed groups in Portage County, one on the west side and one on the east side of the county, that are working on phosphorus and nitrate contamination issues. And it has been done in an incredibly effective way, and I think we need to look at that model and use it on the state level as well.
And are you hoping to have the dedicated person clean water on lead and those other issues coming into the most recent budget as well?
Oh yes, yeah, absolutely, soon as possible.
So specifically for Portage